Hi, and welcome to Homebirth for Homesteaders. I wanted to make these videos for several months now and have been really wanting to share some information for people interested in doing rural home birth. So what is a homesteader? Well, I work in one of the more rural areas in Northern California, and I've been practicing home birth midwife in both Mendocino and Humboldt counties for the last 10 years. And I work with a lot of people who self-identify or like to call themselves homesteaders. And while this video is not exclusive to folks that own land and live on the land or even live in a rural area, it does have specific tidbits if you're further away from an urban setting, which includes a hospital. Because usually when you're in a rural area, unless you just happen to live next to town and it just happens to have labor and delivery, you can be, an hour, 2 hours, or even further away from services. So that's not uncommon here where I live and have been practicing. So I just wanted to divide this up into two sections. This first section that I'm going to share with you today is going to have more tidbits prenatally. We're going to go over, how to keep yourself low risk. We're going to cover the different prenatal tests that are available towards the end of pregnancy, so not at the beginning. You can maybe get that information elsewhere. We'll go over what supplies to have on hand, as well as how to prepare for the birth and who to have there, whether you're going to have medical care from a home birth midwife or go unassisted. And so I just wanted to make sure you had all the information. So we'll go into those aspects of preparing for a home birth, especially living rurally. And then in the second section, we'll cover more of the actual labor, birth, and immediate postpartum. So I hope you stay with me for that. So let's dive in, because I know your time is precious, and I'm all about making videos, and I'm all about making them really simple, really comprehensive, and fun. So I'm going to try to do all of it and keep your attention and try to keep it under 40 minutes. So like 35 to 40 minutes is ideal. I find like closer to an hour and longer, people just, it's too hard. Maybe you want to pause it. So, okay, so let's begin together and go ahead and put away everything you're doing. So if you're, cruising internet or on Facebook, please close that down so we can be together for this time and just come into this place, this time in your pregnancy that's really special, whether you're in the beginning or whether you're towards the end, or maybe even newly postpartum. Maybe you're trying to catch up to see what happened with your birth and are hoping to find some more answers here. So we're going to talk about, third trimester stuff and the pregnancy. So by the third trimester, you've definitely decided where you want to birth. So your options for birth are either home birth, birth center, or a hospital birth. There's another category called hotel births, or you could do vacation rental birth, but I consider that also similar to home birth. Hotel's a little bit different, but most of the folks that I serve plan to birth at home, and I've gone up to 2 hours away from services. Generally, if you're more than an hour away from a hospital setting, whether or not you have a home birth midwife attending you, you may look into a helicopter medical service. That's just because that will take just as long for an ambulance to come to you as it would for a helicopter to fly to you, depending on where you are. There's definitely more remote areas. I have colleagues who've lived and served up in Alaska. My kitty. There's a kitty in the video. Hey, she's very active right now. She's trying to get into the baby basket. And I think she dropped. Did you drop my book? She dropped one of my books that I might show you guys. But yeah, I've had colleagues who live more than, serve areas that are more than 4 hours away from hospitals. So in those cases, yeah, a helicopter ride might actually take longer. But we're not talking about that. We're talking about places that are accessible. I'd like to say within 2 hours is really what I have done and what I feel like I can share. Beyond that, I really don't feel like I can teach. And really an hour and a half is kind of the service area that I cover. Generally, women that are further than an hour and a half, we usually have a long conversation about that and how they feel about that, because it takes that much longer to get to, other level of care as it's needed, if it's needed. So think about all of those factors, and then home birth is really for low risk women, so no pre-existing condition. Generally, if you have one baby, some women will go ahead and attempt it with twins or even triplets. I just read an account the other day about a triplet home birth. So hey, I don't want to tell you how many, but most of the time, like here in California, it's usually for one baby, and usually a head down presentation. So the reason being is that it keeps it low risk. It doesn't mean that a breech baby is necessarily high risk, but you will need to get a higher level of care most likely, especially if it's your first baby. You may not want to just do it at home like that. So to keep your birth low risk, you definitely want to focus on nutrition. And when I meet with families, we talk about nutrition in almost every single prenatal, whether it's just a quick check-in of how are you eating, or do you feel like you're getting enough protein or enough calcium or iron, or specific tips. And I try to only do like 1 or 2 tips per visit. But of course, we're going to see each other at least 10 times, sometimes 12, 14 times. So that's a lot of time to discuss nutrition. It's not like we are only going to have like 5 or 10 minutes out of your whole prenatal care. So, you want to make sure you're getting plenty of protein. And by that, just to define what that means, is at least 60 to 80 grams. And some sources will say closer to 100, like the Atkins diet, which is heavily protein-based, does actually recommend 80 to 100. 100 grams of protein is really hard unless you eat a ton of meat and you do a lot of supplements like protein powders and things, which I feel like you should be able to get the protein from your food. I don't think we need to go overboard supplementing with protein. Usually if you're eating enough calories and you have a varied diet, you're getting enough protein in the Western diet. Of course, if you're highly restrictive, if you're like raw vegan, not to put anybody who's raw vegan on the spot, but if you are eating only certain foods and avoiding others that are protein rich, then you may need to really look at that. And I actually have quite a bit of vegetarian and vegan clients over the years, and they've all had really healthy babies. So I don't even want to put that myth out there, but I do think that you need to make sure you're looking at different sources of protein, because those are the building blocks. And of course, third trimester, the baby's brain is growing tremendously, and every single organ is still developing, and you just really want the best type of building blocks. With that, you want to include lots of green leafy vegetables. That will actually lower your risk of postpartum hemorrhage, getting enough green leafies in your regular diet, and also in teas and tinctures like nettles and red raspberry leaf. Alfalfa, red alfalfa, and things like that can really help reduce the incidence of postpartum bleeding, which is the #1 complication in the world. So not just here in the United States where I live, but all over the world, the #1 reason that women die shortly after giving birth within the first 24 hours is from postpartum hemorrhage is the #1 reason, and the #2 reason is infection. So reducing both infection and the risk of hemorrhage will greatly increase your ability to stay with your baby, stay home, just kind of hang out postpartum instead of having to deal with a lot more medical things. And even if you do lose a lot of blood, there's ways to continue to nourish yourself and add extra fluids and extra soups and extra proteins to increase that iron availability. So those are just some of the nutritional recommendations. There's many others, if you want more information about nutrition, I have hundreds of hours of training in nutrition. I don't even know how many at this point, not just with classes, but one-on-one work that I've done over the past 15 years, a lot of it in different settings. And I'm not, just to be clear, I'm not really into only honoring like the FDA, Food and Drug Administration pyramid. I think it's a disservice that in the 90s and early 2000s they had white starches and bread as the base of the pyramid. It helped create the obesity and diabetes epidemic that we are seeing still to this day. So I think it's good to get whole grains, and I think it's good to get definitely, carb-based, plant-based mostly foods, but I don't think we need to be eating like 12 servings a day of rice, white rice, or bread, 12 slices of white bread. It's not the same as eating like brown rice or maybe a whole wheat tortilla or even sprouted, things that are sprouted or fermented. It's very different. So your body assimilates that nutrition differently. So the other stuff you might consider is some testing that's available. So you want to probably check your iron, which is called your hemoglobin, and hematocrit. So there's different components of red blood cells, but your iron and your hematocrit are parts of the red blood cell. And you can do that through a laboratory, or of course through your midwife, or through, if you have an OB provider. Any number of OB providers that work with pregnant women can definitely check your hemoglobin at the end of pregnancy. Depending on whether there's risk factors for other medical needs, I don't want to go into every single test that's available. It just depends on your situation. But if you're low risk, there's not a whole lot you need at this point, assuming you've had the initial prenatal workup, and then if you decided to do any additional ultrasounds or anything like that, either in the first trimester or in the middle of the pregnancy, around 18 to 20 weeks, perhaps you've already had that. So now you're in your third trimester and really looking towards the end of pregnancy and keeping healthy. So I feel like pregnancy is generally a sign of health, and when you take really good care of yourself, you're not going to have complications. The number one complication is gestational diabetes, and something like 8%, even up to 12% of women have it when they're pregnant, and it's very, very common. And of course, it's diet and nutrition related. So if you have gestational diabetes, having a home birth may or may not be safe. I don't want to be the one that makes that call, but it definitely is something that includes a little bit more specialty care, because both you and your baby may need extra supportive care during labor as well as postpartum. And some of those babies can get like low blood sugar and things like that. So you definitely want someone watching out for them. But the best thing is to just keep a lot of processed sugar out. And some women can't even do fruit. So it really depends how sensitive you are. But that's something you can do prenatally as well. And then at the very end of pregnancy, if you choose to find out, you can find out if you have what's called Group B strep, GBS. And it's a bacteria that's very common. It lives in the lower parts of the body, in the intestines, the vagina, and sometimes can go and overgrow into the bladder, as well as the even the kidneys. And it is something we test for routinely. But at the end of pregnancy, we do a vaginal anal culture, and that's run to see if the colonization is high enough for it to be detected. If so, you're considered GBS positive. Don't freak out if you are. It's just an extra piece of information, but some women will choose to know whether they are or not, because it gives you different criteria when deciding how long to stay home with ruptured membranes. So that's another test that's available. And then depending on what you find out initially, you may need to do a blood typing again, which basically, like, it's the Rh factor, the type of blood you have, and whether the rhesus factor is positive or negative. And very, very rarely women's blood type will change when they're pregnant. So if you're already like Rh negative and you know that, then definitely have it retyped again closer to the birth, because there have been a few cases where blood types have changed. I've only seen it, well, actually, no, now that I think of it, I was going to say I've only seen it go from negative to positive, but I'm trying to think if I've seen it go the other way. And I think I have seen one case where it went from positive to negative. So just have it tested, because hormones can affect it. It's very rare, but it has happened like over the years, and like 15 years of clinical practice, mostly at a hospital, with some hospital, doula care, as well as different situations that I've helped with. Most people had regular blood typing, so it didn't change what the blood type was, but it can. And so you want to do the blood typing, because if you're Rh negative, you'll want to know that information, because there's more you need to do with it. So let's talk about doing a midwife-assisted home birth versus an unassisted home birth. So I've consulted with quite a few families over the years who do what's called an unassisted birth. It also goes by free birth, or essentially it's a home birth where the parents are there and they do not have a trained medical birth attendant. Occasionally they hire a doula. And I have even heard of some people asking a midwife, like I've been asked to attend what people want to call a free birth or an unassisted birth, but I've never actually attended it because I usually explain to the family what my role is. And if I were just like sitting in the other room waiting until something was wrong, I would feel like I wasn't really able to help as well as I could. And there could be things that happen to the mom or the baby that I'm not really aware of until it's a true emergency. And that's just not something that I personally like to bring on. And over the years, as I've practiced over the years, I've really noticed that there needs to be this really inherent trust. And the families who do choose to do an unassisted birth, they know that about themselves. And it's usually what I really recommend is check in with your higher self about that, and definitely do that if it's right for you. But most women really appreciate having a birth attendant who's female at the birth. So some really super independent families will opt out of having a midwife there. But over time, what I notice is that women actually do want feminine energy there. It doesn't mean that all women do. Some women don't, and some women just don't want to be disturbed by anybody, and so they may choose a very private birth like that. But you have to think about the full picture, and if you're more than 20 minutes from a hospital doing an assisted birth, it might be something to reconsider. But I don't want to talk anybody into anything or talk them in or out of anything. But of course, I'm a home birth midwife, and I have seen a lot of different situations. I mean, perhaps because I was there, and maybe if those people had an unassisted birth, they would have just had a normal birth. But over the years, I've attended about 300 births now. I have seen a lot of things, and I do think there's a reason why midwives attend births, and it is one of the reasons why at a hospital birth is considered low risk as having a skilled birth attendant, which midwives, licensed midwives, and certified professional midwives are part of that. But there's also other types of midwives who may not be even included in that. So I just want you to know there's other birth attendants beyond just licensed midwife or certified professional midwives. I just can't include everybody in this talk. So you want to definitely be really, really sure. And also the other reason why people have had unassisted births is because either they don't have a midwife that lives in close enough to their area. Like if she's like 3, 4, 5 hours away, she may not be able or willing to come. And then people have to get really creative. It could also be illegal for her to practice in that state or that jurisdiction, or her license doesn't allow home birth. So there's those kinds of scenarios. And then it rarely, but it can happen, it's a personality fit. It's just for some reason that particular birth attendant does not jive really well with the family, and they just decide that, rather than looking for someone else or having someone flown in from another area, that they are just going to opt to do it on their own. But definitely consider all those things. So what I offer is home birth services, and I do both home visits, and I have an office, which I believe provides kind of the best of all the worlds. So if you want, if you're out on the town, or you just want like a little bit of a space that's not your home that you want to meet in, we can do that, or we could do mostly home visits. It just depends on you and where you live. If you're really super rural, we may not do all home visits because, if it takes like 2 hours to drive one way, it may be easier to meet mostly in the office and then just do a couple home visits. But definitely at the end, we do a home visit at 36 weeks, and I bring my assistant there, and you get to meet her. And then often I also work with student midwives or doulas, and it's something that you can either arrange through me in my practice, or you could hire privately, like a doula could hire privately. So we all meet, and we all do like a walkthrough through the space, find out, where your hot water heater is, and where your washer and dryer are in your kitchen, and where your birth supplies are, and things like that. So that's really nice to do prenatally, and yeah, because we're usually on call for you after that. So I highly recommend, if you have the option of having a birth assistant or attendant to have someone there. But of course, everyone's different, and some people feel that even having like a midwife there who's totally quiet and unobtrusive is just going to infringe on their energy. But definitely do what's right for you, and definitely don't have it be about the cost. Just wanted to keep reiterating that point because birth is really special and it is an investment, and you definitely want to do what's right for you. And not everybody should have a home birth, and I definitely don't think most people should have unassisted birth. But it is something that people consider. So I just wanted to talk about all the options about that. So those are, if you're getting midwifery care, you're getting the regular checkups. So you would also be getting screened for different conditions that would put you out of the low risk category, but you definitely want to stay low risk, and you want to stay within that. Let's talk about some of the people that you want to have on hand for your birth. So it's really nice if you're coupled up to have your partner there. And I know that's very individual, and some dads just don't want to be there. Some dads are unable because they're serving time in the military or doing other things that they physically cannot attend their child's birth, or it's unlikely that they will be there. So if for some reason you don't have a partner or your partner's not able to be there, you may consider having someone there for that role specifically. It could be a woman or a man. I've even had clients have their own dad there to sort of remind them of that masculine presence at birth. But that really depends on each birthing woman. Not a lot of birthing women would want their dad to see them go through something like birth. It's a very transformative time, and so some daughters feel really close to their dads and some don't. So it's definitely a personal decision, but it could also be a friend, a female friend, or a doula, or it's really great to have a relative if you get along with a relative. Usually a female one, but again, sometimes male is what is needed. So you want to have people like that on hand, and then definitely if you have a midwife. Usually midwives work in pairs, so you'll get to meet both the midwives. And then, if you have a third person there, that would be like a doula or a student midwife or maybe a friend. We've had all kinds of people, and usually their role is to help with anything that's needed at the birth. So, hey, your camera just ran out of batteries. Can you go get some batteries at the store? So this person may be available for that. Or, hey, can you make us a snack, because we're all hungry kind of thing. So this person will kind of fill that role. And if it's one of the students that I work with, then I have her do other things like hands-on skills, midwifery skills, and she might also be documenting too. So those are all the things that we would, go over at the birth. And then try to think of it as every single person who's at the birth, including the midwives, but you don't want to just be like, well, we don't want any midwives there, can add extra time to your birth, especially once it's once it's beyond the 2 or 3 birth attendants and your partner. I would say I've seen that happen quite a bit, unless you know them really well and you can drop in. Some women really don't care and they can just go into labor no matter who's around. And some women are very sensitive to energy. So just know you're going to be even more sensitive in labor. And if you're a private person, you might feel even more shy. And birth is kind of a shy process, just like sex is. So even like really open people about their sexuality often don't want a bunch of people in the room when they're making love. So it's very similar hormones and very similar space. Of course, the result is different. You end up with a baby. But that's kind of who you want to invite in, is people you feel that comfortable with. So those are my suggestions. And then obviously if you're, whoever you're working with, whether you're doing a midwife attended birth or whether you opt to do an unassisted birth, you want to make sure there's a backup plan. And this is something I go over with all of my clients. And we generally start here's my kitty. We start the conversation at the initial prenatal or even the consultation about backup. And we usually bring it up a couple times. Definitely at the 36-week visit, we go over that possibility. Like, okay, if you were, if you were to end up needing some more care than I'm able to provide as a home birth midwife, then this is the hospital you'll go to. We're going to call it in. We're going to see who the doctor on call is. And basically, depending on the situation, like most of the transports that we do are non-emergency transports. So there's, not an urgency necessarily, although of course being in labor, you don't want to be in the car for too long. But we are rural, so going from, some of the areas that I serve, like up in Brook Trails, which is only, it's about 15 to 20 minutes from Willits. It still takes, 20 minutes to get to Willits, and then Willits is another half hour to Ukiah where there's medical backup. There is a hospital in Willits, and they can do certain things, but they don't have a NICU, and they don't do cesarean, so they really can't do much. Maybe a blood transfusion or some medications, but that's about it. So we really want to get to the next town, which is a good 45 minutes. But that's like a really common scenario. And I actually know the firefighters and the paramedics were actually, it's something that in a small community, we get really comfortable and familiar with one another. I've had clients who were paramedics and firefighters several times, and they are trained as first responders. And they'll often even say, hey, I heard there was a home birth transfer. Is everybody okay? And while I personally can't disclose information, I can say, oh, it sounds like you were working last night. It sounds like you were busy. Is everybody doing fine? So whether or not I was there, I'm usually not able to disclose a lot of details about the family, but I definitely engage with them on a professional level. And oftentimes we are the ones, the midwives are the ones that have more skills with newborns and moms, so they have us come with them if it is an emergency and stay in the ambulance. So, the first thing is staying low risk, and then once in a while there are medical situations that come up. The most common, and I'll just go over some. Actually, this is for the second part. I want to stay on the prenatal part. So let me make sure I covered everything here. Oh, the supplies. So basically, with my clients, I give them a list of supplies towards the end of their pregnancy, and they have a few weeks before their term to like gather everything. And it's usually, I call it kind of like a fun home birth scavenger hunt, because there's things they might already have around the house. There might be a few things they borrow. Maybe there's a few things they go to the thrift store for. And really, there might be one or two things they might need to buy new, but most of the stuff on there is things they can get secondhand. I mean, you don't want to buy, used things that you would use for certain things, but like sheets, towels, you could get used sheets or towels if that doesn't gross you out. It doesn't gross me out. I just wash them really good and put them out in the sun if you have that option. But yeah, so you wanna have. So I'll just go over. This is not all inclusive, and of course every midwifery practice is different. But things you want to have are receiving blankets, because you definitely want to have something to dry the baby off, and they are very slippery. The thin cotton ones are nice. Don't get super fancy embroidered ones for the birth itself. Of course, you can keep them for the special times or for photos, but they're going to get wet. They're going to get soiled. They may get poop on them. They may get blood on them. So sometimes they won't be 100% clean is what I'm trying to say. We do our best to scrub it afterwards. So yeah, you want to have, depending on what you're planning, 6 to 8 up to 10 receiving blankets. You want to have extra towels, especially with a water birth, 8 to 10 towels with a water birth, at least 3 to 4 if you're doing a land birth or planning a land birth. But definitely the more water there is, the more towels is better. You want to have a couple hats for the baby, and that's just to maintain their core temperature in the event that the baby is really cold and there's a resuscitation going on. We like to cover their heads. We don't generally put hats on babies, but it does really insulate the heat in there. And I've looked at a lot of studies, and it just makes us, it's like one extra step we can take with the baby that needs help. I bring a heating pad, and I use that to heat up my the towel pack that has the towels and the receiving blankets and the baby hats. So that way they're warm to first touch the baby when the baby comes. But in addition to that, some families may buy one of their own just to have, but you don't have to. There's generally, what else is on there? Extra sheets. There could be a mattress cover. So extra sheets, like two sets of sheets for the actual birth, and then you might want to have 1 or 2 extra sheets in addition, because in the beginning, both the mom and the baby have a lot of fluids coming out, and so the sheets get soiled a lot, especially in the first few weeks. You might get breast milk, baby poop on them, baby pee, things like that. So, and then the birth itself, and then there's the discharge and all of that. So you may want to have extra sheets. So just every couple of days you don't have to do laundry. You could just switch them out. But otherwise, just prepare to do laundry. You definitely want to have some diapers on hand and things like that. If you want to have a camera, if you're planning to have photos, or just use your phone. Keep the flash off though for a newborn, because it can blind them. There's been a couple cases where babies got like blinded by really flashy lights after they were born, and so it's better to keep things like not like flash anything in their eye, or even like take a picture up close if there's any chance there could be a flash or a beam of light that goes off. But yeah, camera if you want to have photos, or hire, even some people choose to hire a birth photographer. You want to have food and fluids, extra, coconut water and miso soup for extra electrolytes, or you can make another type of electrolyte solution. I don't really recommend Gatorade, mostly because it's like really yucky, corn syrup and all kinds of things in there that you don't want to put in your body. But I just wanted to mention that, you might want to make an electrolyte solution that has more than just water and lemon in it. It's nice to put a little bit of molasses and a little bit of salt, so you get the different electrolytes in there. Miso soup happens to have electrolytes, as does coconut water, so you can alternate drinking that with regular water. Also, just getting like bubbly water. Some moms really enjoy a little bit of fizz. It kind of settles their stomach when they're in labor. Some moms don't. They don't like the extra bubbles, but it just depends. Something different than water is good. And then soups and broths are really nourishing, and they generally really absorb more deeply. So things like that, and extra pads for the after birth discharge. You also want, places to. I'm just trying to think of what else is on the list. I don't have the list in front of me, so I'm kind of going by what's on my list. But yeah, it's a lot of things that you might use or might not. Like I usually ask for a couple bowls to put the instruments in, or we just use like a cookie sheet that's clean and we lay them out. And I like to have a placenta bowl. Sometimes we do these little, what are they called? Washcloths, but we'll use them for perineal compresses and for cleaning up, like your legs after the birth or between the contractions if there was some discharge or anything like that. There's definitely things like that that are really useful. I'm trying to think, depending on if you need it, you might need alcohol, hydrogen peroxide, other types of cleaning solution, extra laundry soap, stuff like that. Make sure you're all stocked up. Honey and honey sticks are really useful for labor, for extra boost of energy. You want to have batteries and flashlight and candles and extra heat. Like if depending on your source of heat, like if your heat were to go out, is there another source of heat? Especially if it's winter, you want to think ahead. Definitely want to. Kind of have a few steps down the road. So those are some of the supplies that I would recommend. And then in the birth kit that you order for my practice, you would get a little perineal bottle that you squirt on your perineum after birth. That helps you heal. These special gauze panties that you can use that are very, very stretchy, and they just are very ample and spacious that you can use to collect all the postpartum discharge and things like that. There's straws in there. There's what are called Chuck's pads, of like plastic little sheets that you put down so that they absorb fluid and things like that. And we use them for the birth and postpartum as well. You want to have, if you're going to do placenta encapsulation, a container for your placenta. And it's better to have a glass one, like a Pyrex one with a nice lid, than plastic, because plastic will leach into it. But whatever you have will work. Just make sure it's big enough, so at least like 3 quarts generally 2.5 quarts on the lower end, so you can get enough. The placenta will fit, because I mean, I've seen it fit in really small containers, but usually like the tiniest is like a yogurt, like a quart-sized yogurt container. I guess it's a liter, so is that more than a quart? But anyway, that's probably the smallest end, and then bigger is better because it might be big, especially if you have a nice sized baby or you ate really well. Some placentas are really nice size, like 2 or 3 pounds even. So yeah, those are some of my recommendations, and we'll talk about the birth in the next video, but I wanted to just get this out to you and make sure that you had the first part of Homebirth, Homesteaders, Homebirth for Homesteaders, and can start enjoying it this week. So again, I'm Midwife Monica with midwifemonica.com. My practice is called Tree of Life Midwifery Services. I live in Mendocino County, and I have served rural birthing families for over 10 years in my private practice, and I've worked with families for over 15 years at this point in many settings. So let's tune into the next segment, and I hope you guys have a beautiful rest of your day, and let me know if you have any questions at midwifemonica at gmail.com, and I'm also on Facebook under Tree of Life Midwifery Services. Have a beautiful day. Namaste. Bye.